Have y'all heard about it?
Oh, just doing research. Yeah, a lot of people are like debating whether or not they should go to medical school or PA school. You know, like.
All right,
So.
fair enough. I hadn't heard of them until I was a senior in undergraduate school, or in my undergrad years. I went to University of Florida. We actually have a PA school, and I didn't even know it was there. I was kind of pre-med for a long time. Wasn't entirely sold on it. It's a lot of school. It's a lot of years after undergraduate that kind of get sucked up not having a life. And so I was talking to my dad, who's a physician, and he said, what about PAs? Have you heard of them? And I hadn't. So I kind of shadowed one, and I really, really liked it. And I spent about 3 years after undergraduate working in a clinical setting. For PA school, they usually require about 2,000 clinical hours. So that's a year of full-time work just to get experience to apply to school. And I worked with 3 PAs and a physician in an outpatient setting, and really liked it. PAs had their own schedule. They saw their own patients. They treated their patients all on their own. If they needed a little extra help or there was something they weren't unsure of, they could run to the physician. But for the most part, they were kind of on their own. And I really liked it. They had a really good rapport with their patients, and they kind of had their own patients they saw on a regular basis. They had a good relationship. And I decided that's what I wanted to do. And PA school is about 27 months. So it's modeled after medical school. A lot of PAs refer to it as a mini medical school. It's about 4 semesters of didactic learning instead of 2 years in medical school, and then we do a year of clinical rotations. And the best thing about being a PA is you're trained to work in any field of medicine. If you go to medical school, you have to specialize. You do additional training, you do a residency, and you specialize in emergency medicine or in internal medicine. And as a PA, you get a little bit of everything, and if there's a physician there, you can work in that field. So right now I work in general internal medicine. If I ever get tired of it, I can pick up and leave and go to whatever kind of practice I want, dermatology, pediatrics, OB-GYN, and I can work in that too. So that was really, really a big selling point for me. I don't want to spend years specializing in one thing and then have to turn around and change it all up if I wanted to do something different. My husband just finished medical school, so for me that was really, it's a good part that I can speak to in terms of the difference in medical school and PA school. There's no way in heck I'm going to go to medical school. It's just a lot. But it's definitely a good opportunity if you can't work under a physician or you want to be all on your own. PAs, sorry, I'm a little nervous. PAs work under a physician. So I have a supervising physician. If I need him, I can go to him during the day when I'm seeing patients. But I don't have to. And so for me, that was kind of a nice option. I kind of knew enough, and I can treat the basics. I can treat hypertension and high cholesterol and stuff on my own. But if there's something weird or there's something unusual, I can always go to the physician if I need to. Y'all have any questions right off the bat? Yes.
So you say your husband is just finished up medical school, right? So
yeah.
He's going through residency right now, right?
Yeah.
So knowing what you know now, do you think you make the right decision by going to PA rather than
do I think
yeah
oh
or
my God, yes.
Yeah.
Yes.
Is it really that scary or?
It's just different. I mean, for me, I'm a girl. I want to have a family. I want to have kids. I want to be able to stay home with them and have a life. Most kids that we know that we went to high school with, they're his age, have homes, they have kids, they have a family, and he's working 120 hours a week. I might see him. He's working nights right now, so I don't see him at all.
Wow.
And I get up in the day and I leave, and he comes home, and then I get home from work and he leaves. So I don't get to really see him much at all. And to be a doctor, you sacrifice a good chunk, most of your 20s usually, you sacrifice a good chunk of your life. And it's well worth it. You're well educated and you're able to take care of your patients. But it just wasn't an option I really wanted. I wanted to do my 2 years and I'm done. So for me, no, there's no way I could do that. So, you have one?
I shadowed my friend, and it did seem like she got to bounce around to a lot of different places.
Okay.
And now she's talking about specializing. What's that process like when you specialize?
As a PA?
Yeah.
What does she want to specialize in?
She's going into like pulmonary.
Okay.
Some type of clinic they're setting up, I think.
Okay.
Is it simply her working in that department and she simply gets familiar with the?
Yeah, pretty much. For us, because when we do our 1 year of clinical rotations in school, it's just like the third year of medical school, where they do 6 to 8 weeks of a specialty and 6 to 8 of another. That's what we do. So I did 6 weeks of internal medicine. I did OB-GYN, I did a surgery rotation, I did an ER rotation, a little bit of everything. And so basically, for me to work in a specialty, all I have to do is find a physician that wants a PA. And once that physician hires me, they teach you, so it's a little on-the-job learning. You learn from the physician. And then some specialties, if you want to do like dermatology or something, have courses. You can actually do a certification with some online classes, but you don't have to. It's all up to your physician. So for PAs, the big thing is your supervising physician. That's the one that you work under. They kind of shape and mold you into what they want. So if they want you to do the courses, you definitely have to do them. But if they're okay just teaching you, hey, this is this kind of patient, and I like this treatment, and this is what I like to do, and they'll explain to you, and that's fine too. Yeah.
What's the cost, like medical school versus PA school?
Well, my husband went to a public school for medical school. He went to Florida State. He owes $180,000 for medical school plus interest. So that's a lot of money, and he had scholarships. So it's a lot. I went to a private school, and I owe about $70 for PA school. So I mean, it's a lot shorter, but I paid more per semester. But you know, together that's a really nice house's worth of debt that we have that we're paying off. So you know, I mean, if medical school is for you and you really want to do it, then in the end you're going to have a stable job. You're going to be able to pay it off. That's not the end of the world, you know. And there are special loans if you go to medical school if you want to buy a house. You can defer paying off while you're in residency too, because you don't make much as a resident. So you know, it's a nice option. And there's some new loan repayment programs where they take like how much you make a year, and you only have to pay 10% of that back for 20 years. And after 20 years, they just forgive the rest of it. So that's what I'm doing for my loans right now. We're just paying the minimum based on what I make, and then after 20 years, whatever I have left is forgiven. So, yes.
You mentioned the clinical hours that you had to get in order to apply to PA school.
Mhm.
Did you just do that at a local hospital in Florida? Like, what are some things that maybe students can do here to apply?
Okay. I worked in 2 different areas. I found a physician back home where my parents were after undergrad who hired pre-med and pre-PA students. It was outpatient dermatology. I worked about 65 hours a week in his practice, and he had PAs. So I got some good experience with PAs and physicians there. I also worked in like a doc in the box, like an urgent care kind of setting, and I just volunteered there. And they paid me after the first year, but I volunteered just to get that experience because PA schools, not all of them, but some of them require a certain number of clinical hours. And so the best way to do it is just get in touch with physicians, shadowing if you can. Shadowing is really great because to apply to PA school, you have to have letters from physician assistants. So you have to get in touch with at least one of them and get them to kind of see how you are clinically and write you a letter. And that's probably going to be a tougher part to find for the application process because there's not a whole ton of PAs here, I don't think, that I've seen.
And that's actually the next question is how hard is it to find PAs to shadow to get them all those clinical hours?
Yeah. There's a website, I'll write it up here. It's the South Carolina Physician Assistant website. And they actually, like, they'll ask you, when you're a PA practicing here, they'll ask you, hey, are you okay having someone shadow you? Or do you want to mentor someone? So it's scappa.org. And I don't know the exact link on there, but I think there is one you can go to. And it'll list all the physicians, or physician assistants in South Carolina that'll open to shadowing. Yeah.
Do you think it would give you an advantage to be a nursing major where you get all those clinical hours while you're an undergrad to apply?
Most nurses that want to go into a mid-level position, like a PA, because PAs and nurse practitioners are both considered mid-levels. They're not physicians, they're not nurses, they're kind of that in-between area. Most nurses tend to go the nurse practitioner route. To get into NP school, you have to have been a nurse.
Okay.
So for a lot of times, they go in there. There were 2 nurses in my PA school class, and they did fine. They worked in the ER for a couple of years and got some experience, and they did great as a PA. I will say, more physicians I know like the PAs more because our education is modeled after medical school. The nurse practitioner education is modeled after nursing school, which is a whole different philosophy.
Okay.
So the doctors tend to like PAs because we think the exact same way. We're trained the same way to think about patient problems and how to solve them. So,
Okay.
I mean, it's not to say it can't be done, but most nurses tend to go to NP school if they want to.
Okay, so it doesn't really give you an advantage. Say It just kind of.
No, I mean, it's a great way to get your clinical hours though,
Yeah, I was
you
gonna
know.
say.
There were about 3 or 4 kids in my class, my PA school class, who were scribes in their local ER too. And they were able to get a lot of hours and experience that way and see a lot. And I think that was just kind of volunteering through where they could find. And we had about 3 or 4 that were not personal trainers, physical trainers. We had one that was like a respiratory therapist. So they'd gotten some experience from different areas too. And we had some that had gone on and gotten their EMT licensing or certification and practiced as the EMTs and ambulances and first aid responders. They got experience that way.
You mentioned when you get service or clinical hours,
Mhm.
they count volunteer hours, is that?
It depends what kind of I mean, if you're volunteering for like the Humane Society, that doesn't count. They want patient contact hours mostly.
So even if you're not actually like changing bandages or anything, you could just be like escorting them to a room?
Oh yeah,
They
yeah.
consider that? Okay.
Yeah. And I mean, yeah, anything in a clinical setting. So if you're working in a hospital or a clinic or where you're taking care of patients, that counts usually. But when you go to apply to PA school, just like when you apply to medical school, or I think dental does it too, there's a central online program you have to use, and you submit all your stuff to them, and they'll ask you, they'll say, how many hours do you have? What kind of setting is it, and what were you doing? And you'll get to explain exactly what you were doing there when you're applying. Yeah.
Roughly, like, how many southern PA schools do you know that are around?
That's tough. I moved up here in July, and I know there's one here in South Carolina. I'm from Florida. There's 10 PA schools in Florida. So it's...
So what PA schools?
They do. There's 10 PA schools. There's 11 medical schools. I mean, if you want to pursue medical training, Florida's a great state. There's a lot of opportunity there. I think I heard that there's about 150 PA schools nationally. So, I mean, there's a good bit out there. There's one in Savannah. And I think there's probably 2 or 3 up in North Carolina that are nearby. I know there's 2 in Georgia too. Yeah. Any other questions?
You can go ahead, buddy. I don't know already.
What kind of difficulties do you see? Like, what are the setbacks of being a PA? Sounds all nice and wonderful.
Yeah, I mean, I'm a very happy PA, so I don't have a lot really to complain about. For the most part, the only people I know that are really unhappy PAs are surgical PAs. Because surgeons are kind of tough to get along with in general. And a lot of the times, if you're working in a surgical specialty like orthopedics or something, you're doing a lot of the grunt work. And those PAs are pretty unhappy for the most part, the ones that I know. They feel like they do all the work and you get paid like the 10th of what the surgeon does. Really the only setback is if you wanted to have your own practice. You can't do that as a PA. You have to work under a physician. And I think the laws here in South Carolina state your physician has to be within 60 miles. So if I wanted to go to another office, I certainly could. But if I wanted to have my own office, my own patients, and run everything, I can't do that.
I heard PA school is very competitive to get in, and the average age is like 28 compared to,
Really?
yeah,
Oh,
compared
okay.
to like 22 or 23 for medical school. So they're really looking for, I guess they're really looking for people who have really had a lot of experience with,
Yeah.
having a lot of clinical hours. So did you get in right after you graduate, or did you like have like a year off or 2 years off where you work and gain a lot of clinical exposure, and then you
Yeah.
apply?
Like my senior year is when I heard about PA, so I didn't have a lot of time to apply, and I needed those clinical hours. So I kind of started working, and I actually ended up working for 3 years before I started PA school, 2 years before I applied. And I got, like I said, I worked about 60, 65 hours a week. I got a lot of patient
Wow.
exposure. It was a outpatient surgical center, and so the PAs I worked with, they were great. They trained me how to suture, so I got to suture patients. They trained me how to take care of bandages and do a lot of stuff. So I got to do a lot of my own there. My PA school in Florida, I think our average age was 23 or 24
Oh, really?
starting out.
Wow.
We were younger. There are definitely some older PAs in our class. I think the oldest person in our class is like 55. There's quite a wide range there. I think for PA school as opposed to medical school, PA school is something, people who are MAs, who are medical assistants, or who've been out of school for a little while might not be so happy what they're doing, and they tend to want to go back to school. And I think that's why the PA age might be a little higher, as opposed to medical school tends to be more did undergrad, were pre-med, wanted to be a physician. It's a lot of training, and so I think once people hit a certain age, they don't really want to do medical school and residency and further training. So that might be part of it.
I got you.
I know PA school is really competitive. I keep hearing, because I've kept in touch with a few friends who are applying now, and I've heard that it just is getting more and more competitive.
Yeah.
And it's a great opportunity, and it's a great job, and I think that's part of it. And I think part of it is my PA school class had about 60 kids, 45 were girls. And I think the bigger pull for girls is the ability to be done and have a family. As cheesy as that sounds, I know y'all are young, but when you get a little older and you kind of want to have a family or you think about settling down, it's a really nice option to do 2 years and be done, as opposed to thinking about having a kid in residency or.
That'll be horrible.
Yes. yeah. So I think it's a really, really good opportunity to be in medicine and have your own patients and care for people, but to not spend your life studying.
Yeah. Gotcha.
So you have like regular hours, it's like an 8 to 5 kind of thing, or is it?
I work 4 days a week. I do 7 to 5, 3 days a week, and 7 to 4 on my Fridays, and that's it. Yeah, it's really nice. I don't have to work in the hospital. I don't have to go in and round. I just walk in, I see my patients, and then go home. That's it. So it's a really good deal for me. I'm quite happy. I do internal medicine, so it's a little bit of everything. It's kind of family medicine, but a little more intense. So it's your diabetics, they're maintained on 3 or 4 medications as opposed to just 1 or 2. They're on insulin. Got a lot of other problems.
I know from some of the physicians I've talked to, my dad, one of them, he was saying that for PAs, is it ever like that their hours sometimes aren't as good as the physicians because the physicians kind of like have more schooling and so they give like the worst hours to like the PAs to cover stuff? Like, do you think is that a thing? Because you're kind of like a little bit lower down the totem pole, so.
Yeah, one of the big things for PAs, especially when you get hired, is you got to look for a physician who's going to respect you as a PA. You want someone who's going to not dump all their crap on you because they want to get out of the office, honestly. So there's some variability. I have, there's definitely some kids in my class, and we're only 6 months out from graduation, who've already changed jobs because they felt like they were getting all the crap their physician didn't want to deal with, and so they left. And the great thing about being a PA is you're in demand. There's a lot of places that want PAs right now, so you can just pick up and leave if you're not happy. And so, you just have to find that respect. I feel pretty good where I am. I know my physician completely respects me. If I ever have a problem with a patient, or it's someone who's been nasty to me or has been rude, doesn't want to see a PA or something, I'll tell him and he'll go see the patient, and that's fine. So I don't have that problem. I know some of the PAs, like the surgical ones I talked about, feel like they get the crappier hours, because they do. And you're there to make the physician more efficient. That's your job. You're seeing some of the lower acuity patients, so the physician can get tied up with those really complicated patients that need their attention. And so sometimes you get the short end of the stick, but it shouldn't be all the time.
Okay.
Any other questions? Yeah.
So being a PA, do you think maybe people don't respect you as much? Like they think, oh, you're a PA, you're not qualified, to treat me, Do you get that a lot, or is it just few?
It's improving. Some of the PAs I've talked to that have been around for a long time used to have a lot harder time with that. I haven't had any problems with patients here being like, you're a PA, I don't want to see a physician assistant. It's that assistant word. It gets them real mixed up. But I haven't had too many problems with it, especially once they've seen you and they kind of feel like you're a competent provider and you're taking care and you care about them. That usually kind of calms them down for the most part. But there are definitely a few that are like, I need to see a physician, I need to see a doctor.
That's terrible.
That's fine, because if you're going to be like that, I don't really want to see you either. So it's,
That's
my
right.
physician will just
That's
it's not a problem. But there's not many that I've bumped into like that.
Okay.
Any other questions?
I don't know if we have a pre-PA track here, but are there some classes in undergrad that you would recommend for students to take, like physiology and anatomy and things? Is there anything extra that you think would be good for a PA?
There's a lot of prereqs. The biggest pain in the butt when applying to schools is looking at the prereqs, because every school is different. For medical school, there's like, you want your Gen Chem and your Gen Phys, or General Physics, and your biology and your orgos, and that was like it. But for PA school, they want you to have microbiology, they want you to have a genetics course a lot of times. They have a lot. So if there's a school you have your heart set on, I would call them up and see what they actually want you to take. Sometimes you'll get what they call kind of bonus points in the application cycle for taking extra courses.